Those of you familiar with eConsult know that we pride ourselves on the clinical safety we offer both patients and clinicians. To do this, we've built various safety netting features into our system. These include patient-facing red flags embedded throughout our questionnaires, ensuring nothing urgent is delivered to practices via our platform, and practice-facing indicators that highlight key information to navigators or clinicians within an eConsult report so that patient needs can be triaged quickly. Another one of our key differentiators is our ability to provide you with a concise, structured patient history up front ahead of you seeing the patient. This ensures that you have all the information you need to manage patients remotely in the absence of a secondary contact with the patient where possible. And the launch of our Smart Inbox will allow you to view, filter, and sort your eConsult queue to easily triage patients and allocate them to the most appropriate role, team, or clinician. You and your colleagues will be able to manage, respond, and collaborate in this dedicated eConsult inbox, either within your practice or at scale across your primary care network. We're making sure you can unlock the value of the rich, structured history you've come to expect from eConsult to reduce the administrative and clinical pressures on your team. I'm now going to hand over to Aman to give you a bit more detail on the inbox.
Hello there everyone, my name is Aman Kundral. I'm the Commercial Director at eConsult. Now I'm going to briefly walk you through a demo of our Smart Inbox, but importantly I'm going to show you the end-to-end journey, so from a patient submission and how that submission presents into the inbox itself. So this is a landing page for our test practice, as you can see here, and I'm just going to pick a reasonably common complaint. So I'm going to pick back pain for the purposes of this demonstration. I'm going to bypass all the self-help and signposting options and go straight to an e-consultation into the practice. And then I'm just going to quickly get through the privacy policy and some of the simple information. So urgent warning question, not suffering from any of those. I am going to use NHS Login, so I'm going to use my own NHS Login credentials just so you can see how NHS Login integrates with the platform one, but also integrates with the Smart Inbox. So I'm just going to populate in my password. Now that will take a moment just to confirm my credentials and pass me back into the consultation. You may note across the top it says, according to my NHS login details, you're not registered at the test practice. I'm obviously not, this is not my home practice, but for the purposes of this demonstration, I'm going to confirm that I am, and I'm going to continue. So I confirm my sex, my date of birth is pre-populated, and then I'm just going to put in some dummy data to allow me to get through the consultation at pace. Any particular help? No. Is my back painful? I'm going to say yes, it's a back problem. I'm going to say no to that. Doesn't hurt when I move my chest. No pain in my abdomen. Moderate pain, so give it a pain score of 5. Sometimes it distracts me from usual activities. Doesn't wake me up in the middle of the night. I didn't injure my back. Also no. So this one, I'm just going to trigger yes to any numbness in your bottom area. And as you can see here, this immediately stops the consultation because it potentially highlights a higher risk symptom, and it signposts the patient to more urgent or acute services. So for example, signposting the patient to 111 or to the local A&E, depending on the severity. And I would get that guidance as soon as I seek to end the consultation. I just wanted to show you the red flags that are built into this platform for safety, but I'm going to go back and I'm going to change my answer to no numbness in my bottom area, no temperature, no profuse sweating, no vomiting, no blood in my urine. And now the last bit here, one of the last bits, I'm just going to show you how you can upload a photo. So, and again, how that integrates into the Smart Inbox. I'm going to add a photo, just pick one that's already sitting in my folder. Again, just put in a test description. Anything else? No. And then we get to the health background questions. So any medication, cough questions, so alcohol status, smoking status, do I have any allergies, and has anybody had COVID in the household? So those questions, the cough and the your health questions, will soon be configurable. Currently they are static, but you as a practice, you'll soon be able to configure whether you want them on or off, or whether you want them to be populated to patients after set periods of time. So you may say, I wish to update my information every 4 weeks. So I'm going to continue just confirming the rest of my demographics. This is pre-populated from my NHS login credentials. My address, I'm just going to put in our company address. And I'm going to find it. I'll put in MyMed. Next steps. Confirm my contact details, which again come from NHS login, my phone number and my email address. Would I like to request help from a particular member of the practice team? No. And then the last bits here from a patient perspective is I can choose to have a copy of my consultation answers emailed to me for my records. I can also opt into a one-time survey. This survey is an opt-in. Approximately 15% of patients complete this survey, and those details are passed back to practice and CCG on a monthly basis. So I'm not going to opt into either of these. And now I'm submitting my consultation. And as you can see here, just confirm that this consultation has been submitted. This information is also emailed to me. Here I get my response timeline. So in this instance, I can expect a response by 6:30 p.m. on Thursday. I get worsening care advice and just some guidance from the practice for the patient rather in terms of the practice contacting them. Okay, so that's the end of the consultation. We're now going to move over to the Smart Inbox. Now, as a practice user, I'll access the Smart Inbox using NHS Mail single sign-on. So if I click this login symbol in the middle, it's going to pass me through to my NHS.net login account. So I'm just going to use my own NHS.net credentials. That's going to pass me through to the consultation or through to the Smart Inbox. And as you can look through all open consultations, you can see right at the bottom here, this is the consultation I've literally just submitted. Now, before we go through that in a level of detail, I'm just going to give you a brief overview of some of the key features. This is your inbox pane. So this is going to give you an idea and a view of all open consultations, any that you've marked as complete, and a segregation of clinical consultations versus admin consultations. That segregation is predetermined based on the consultation type the patient submitted. Now, those headers also have some sub-indexing. So as you go through the triage process, ones that consultations that haven't been reviewed will be sitting as waiting. You may have looked at some and thought, okay, I'm going to snooze it because I don't have time to look at it now, or I've got more urgent cases to look at, but I just want to ensure that anybody else looking can see that this is in my work list. I may have sent the patient a response seeking further information or clarification, and I've just noted that accordingly, or I can mark it as triaged, i.e. triaged but not fully managed or complete in this instance. And the sub-indexing is exactly the same here for administrative consultations. Now, in the top right here, you can see my name, and I can choose to log out the account at any point. This is the beta test site, so just point of reference, this is not a live production environment, but just to give you a look and a feel. Here I can just review the practice that I'm logged into. If I were part of an eHub, and I had a federated offer of my online consultations, then they were managed through the Smart Inbox, all practices that were associated to the hub would be listed in the eHub section here. In this particular instance, my account is not associated to a hub. And the last thing I wanted to show you is the intercom feature in the bottom left. So as a user, you have access to a series of self-help guides and user guides and articles, and these can be searched for at your volition. If you did want to send us a question, you could send a question into our support team, and they typically respond within under 5 minutes. And as you can see, the wait time is under 5 minutes at this moment in time. So I'm just going to minimize that. Now I'm going to go into this consultation. Now, actually, before I do that, I just want to show you one more feature, and this is the sort. So I can sort the consultations as I see them. These are all open consultations. I can sort them by time received, and at the moment it's configured oldest to newest. I can do it by age, so currently configured youngest to oldest, so I may wish to see pediatric consultations in the first instance, or I can sort by flags. I can do least to most or most to least. And again, those flags are a potential indication towards patient acuity. But I'm going to leave this at time received and apply that. And as you can see right at the bottom is the consultation that I've literally just submitted. So I'm just going to click into that. Now, again, just for point of reference, top left-hand corner, you've got the unique consultation ID. This is the consultation ID that we generate. You can see the submission date and time. If I click here, you can see my details as a patient. So my date of birth, NHS number, gender, contact phone number, contact email address, and my home address. A timeline for a response for the patient, and just some flagged responses. Some answers do need some closer review. And I'm not going to walk through the structured nature of the consultation in any particular detail, But just to give you an idea, the first part here is the ideas, concerns, expectations of the patients are outlined, then a breakdown of the clinical questions and the flagged responses, as well as free text responses. So we can see here, for example, I've put pain score of 5, so moderate back pain, and again, another free text response. Any pictures I upload, confirmation that as patient have been okay to upload photos, and just I've confirmed that the warnings in regards to data retention have been agreed. Any health and cough responses, and then the image itself that I uploaded. Now, if I move across to the next pane, the next pane is a signposted pane, and this allows you to manage the consultations effectively across a multidisciplinary team. So across here, you'll see it's currently unassigned. So this consultation has not been reviewed by anybody. Just in the bottom left here, you can still see it's waiting. So I can choose to assign it to a particular role. Okay. Now it's a MSK consultation. I may choose to give it to a physio. I've got a physio within my team, and that's who I'm going to assign this to. On the initial triage, I've determined that it's moderate back pain, no emergency flags. I believe a 48-hour response is acceptable. I can also recommend a response modality. So I think the physio should probably contact the patient potentially via email, but it would be the physio's decision, but I can provide a guidance, or I can leave that as unassigned. It's currently marked as a clinical consultation because it's for a back problem, but you may feel that actually it's more suited to an administration activity, so you can move the main queue, but I'm going to leave it where it is. And then the status. So the status is currently waiting because it's not been looked at, but I'm going to say for this instance, I've triaged it, and that's the queue that it sits in. And then I can leave a comment. So within the logbook, I can say, triaged, for 48-hour response, and save that. Now you can see my comment is listed, so anybody who looks in the consultation can see my comment, but I can also look at all activity. And the all activity comment here, once I save my changes, if I go back into the consultation itself, just at the bottom here, you can see that I've moved the status from waiting to triage, and when I did it, I've assigned it to a physio when I did that. I've recommended a response window in regards to urgency, and when I did that, and again, the comment that I left. Okay. And that sits there. So any changes subsequently would sit within the logbook. Now, the last activity, you'd go back into the main panel or main pane, and you can filter your smart inbox. So I know that I've selected this by team, so I can say I want to then filter this by team, and I know my consultation I've just added to physio's work list. So I can say, okay, I'm a physio now, and I want to look at all the consultations that are pending my review. I can apply that filter, and as you can see, this consultation is pending my review.
We offer a number of integrated communication channels to allow you to respond to your patients once you've reviewed the online consultation. These options are available via our toolbar, which will sit on your desktop, so you can use it with the inbox or alongside the patient record. Going forward, you'll be able to launch the inbox directly from the toolbar. For the purpose of this demonstration, I'm going to show you our integrated synchronous and asynchronous communication options working with EMIS.
You can see I'm sat in Marge Simpson's record in EMIS, and the toolbar sits and floats on top. You've got 3 options within the toolbar: the megaphone that keeps you up to date with eConsult news and updates, the messaging section, this allows you to send emails and SMS messages, and the telephony and video section. You're able to send post-consult emails, which is using a pin from that eConsult, and then also SMS messages. You can see there that there's an active patient, Marge Simpson's, being pulled through. And to send an SMS, simply click on that, and then select the number that you want to send your SMS to. You've got the ability to free text or use a pre-created template. Once you're happy with the message, it's simply a case of pressing send. It can be up to 1,000 characters. You've got the option of 2-way SMS messages as well. Once that, you're then able to save it to the patient's record. Once that's been saved, you'll see that you get a green banner confirming, and the EMIS will request to refresh on there. There you go, got the green banner there, and then you can see if I click to reload, that message will appear at the top of the consultation record. The other option is the post-consult email. Now this is a direct response to an eConsult that will be submitted. So it's a case of entering the PIN, which is located at the top of an eConsult. From there, you can see that the patient's details are matched to that eConsult Marge Simpson, and it agrees that it's currently active in EMIS. Just like with SMS, you've got the ability to write your own message or use a pre-created template. You can amend that message, and as it's an email, it can be longer. And you've also got the ability to add information and links and videos and self-health advice provided by Healthy Note on there. So, for example, with smoking, links and, for example, NHS guidance as well on there. Once you're happy with your message, it's a case of confirming and sending that message. This too can be saved to the patient's record. The next communications tool is the video and telephony. Again, it's a case of selecting the number that you want to use from that patient's records, and then selecting whether or not you want a video or a phone call. If you choose phone call, you're able to use a different device to have that call. It might be that you don't have a microphone or speaker on your computer. Once you've started that call, the patient will be rung. You've got the ability to mute, end that call, or always to convert it to video should you want to. It might be during that call you want to see a visual. Simply a case of pressing the video icon and sending an invite to that patient. The phone call will then end, and you'll be kept in a holding screen until that patient joins. You've got the ability to convert it to a phone call if that patient didn't arrive, or if you chose to do it via phone instead. Once the patient joins, there'll be a green tick and the join consultation button will become active. From a patient side, it's a case of entering that patient's name and giving permission for camera and microphone on there. You'll see now that that green tick has appeared and the patient is within that consultation. Just pressing join. Just like with other video providers, you're able to switch off the microphone, your video, and also blur the background. You can also add participants to the meeting should you need a chaperone, a translator, and also within that video consultation, you can share documents and files should you want to. There's two ways to end that consultation, either by converting it back to a phone call, maybe you've just popped on briefly to see a visual, or you can hang up completely and end that meeting.
There are a range of these options, but the most commonly used include initially your ability to adapt your response time to fit your chosen service delivery method. This is defaulted to the end of the next working day, but as a practice, you may choose to ensure that your patients receive a same-day response or a 2-hour response. We have a range of templates that we've considered as configurable. This is not the entire range, but there are select templates based on the practice's preference or the practice's own service delivery method that they may choose to deactivate or activate. This includes our pediatric templates, chronic disease and review templates, and our travel template. And the last element is our demand management suite. Now, our demand management suite is split into two options. You have ad hoc demand management options and planned demand management options. Your ad hoc options allow you to snooze the consultation functionality where your circumstances change at very short notice. So by way of an example, you may have had a clinician or a number of clinicians call in sick. You don't have the capacity to deal with all of your planned demand as well as demand through an online consultation channel. And at that point, you can snooze your online consultation option for the next 24 hours. You can also plan your demand management features. So the first example of that is you can do this by time. So you may choose that you wish to deactivate the consultation engine in the evenings and or the weekends, and that can be planned in. Or you can do this via a capping methodology. So you can determine exactly how many consultations you can manage at a given time on a day-to-day basis. And this can be planned 1 week in advance. So Based on your available clinical resource, you can determine, by way of example, that you could manage 50 consultations on a day, and then you could cap your demand at that level. Now, just to move on, the last element I'm going to discuss is our eHub module to support federated working. Now, as you've already seen our smart inbox, we've taken that smart inbox and we've supercharged it with AI. And we've done this because there is a significant drive for PCNs to be working at scale. And we believe that an effective, robust, efficient, scalable digital front door to that at-scale working at PCN level is key. We're using AI to support your initial triage and allocation in practice. Now, what we believe that eHub will do is it provides a consistent patient management experience. For you as a PCN and as a group of practices, it gives you significant levels of resilience and retention and recruitment opportunities. It allows you to add some maturity to how PCNs work together, which we acknowledge has got a different, all PCNs are different. But the most significant element we've seen is the advantage of using a multidisciplinary team and using that very, very effectively. We set up our first eHub more than 5 years ago. It's still running today, and it's evolved several times in that period of time. Since then, we've supported the setup of 10 eHubs. We've enhanced our product to provide some commonality, but significant levels of enhanced functionality that really add value back to PCNs, and we'd welcome an opportunity to discuss this with you further. Thank you for your time. Please do feel free to contact us if you have any more questions.